The hidden risk of gabapentin. What if a medication touted as a safe alternative to opioids could lead to serious health complications? Gabapentin is now among the most commonly prescribed pain medications in the US. Yet, its hidden risks are becoming alarmingly clear. Today, we'll explore these risks and the implications for patient care, paired with real-world examples that reveal the pressing need for awareness and caution in prescribing practices. Gabapentin has become the seventh most prescribed drug in the US, prescribed over 15.5 million people in 2024 alone. Originally approved for seizure and nerve pain, it has increasingly been used for an array of conditions, often without FDA evaluation for those off-label uses. This popularity stemmed partially from the opioid crisis, as healthcare providers seek alternatives for pain management. While its use has soared, we must address the concerning reality of its safety profile. Recent studies suggest that gabapentin is not as benign as once thought. Research links it to greater risk of dementia, suicidal behavior, and severe respiratory issue in patients with pre-existing lung conditions. Alarmingly, some patients report debilitating withdrawal symptoms when attempting to taper off the drug, resembling those associated with addiction. As we move forward, it's crucial to examine the implications of these risks within clinical practice. While some doctors advocate for gabapentin in treating specific types of neuropathic pain, it's often prescribed for various unrelated conditions. In fact, more than 90% of Medicare beneficiaries who received gabapentin did so for off-label use. This raises essential questions about the oversight in prescribing practices and the need for more thorough risk assessments before administration. Next, let's consider the real-world consequences of these prescribing trends. The tragic case of Nancy Hammer, as posted on the Wall Street Journal, it is a sad story about Nancy Hammer. She died from a toxic cocktail of medications, including gabapentin, will highlight the potential dangers of inadequate communication from healthcare providers. Her family alleged negligence, emphasizing the importance of informing patients about medication interactions and risks. This case led us to reflect on our role in patient education and shared decision-making. To mitigate risks, healthcare professionals must implement best practices in gabapentin prescriptions. Key strategies include thorough patient education about potential side effects, advising on gradual tapering when discontinuing the medicine, and regularly reviewing medication regimens for efficacy and safety. Transitioning to our final point, it's clear that maintaining vigilance and informed consent is vital in clinical practice. As gabapentin continues to be widely prescribed, it's crucial that healthcare professionals remain informed about its risks and communicate this effectively to patients. By fostering a culture of informed decision-making and vigilance, we can better navigate the complexity of pain management in the wake of opioid crisis. The time for increased awareness and caution is now, for it's not just about alleviating pain, but also about ensuring patient safety. Thank you for watching and stay tuned for more insight into safer prescribing practice. Please like our video to encourage us to bring more content online.